Aloha! This CME activity is jointly provided by the Queens Medical Center and UH-JAPSOM Department of Geriatric Medicine. We offer free continuing education for this series. In order to receive a CME or CEU, participants must complete the online evaluation at the end of the webinar. Your comments are very important to the planning committee and will be used to plan future programs. Health professionals, you can now check on your CME credits online. Go to www.queens.org and type CME in the search tool. Click on My CME Transcript, then sign in to generate your transcript. We want to remind everyone that this is an ECHO webinar, which means that this session serves as a forum for mutual teaching and learning from experts and from each of us on the front lines. As the ECHO motto goes, all teach, all learn. So it will take all of you to create this community of learning. In the spirit of aloha, we encourage you to turn on your cameras to help us build a community of learning. Feel free to eat during this ECHO session. Good nutrition is key to a healthy lifestyle. A little bit about our format. After a short lecture from our experts, we will share expertise from the rest of the team and then open the time up for case discussions. We invite you to share any geriatric cases. It may even be on a topic not related to the topic of today's lecture. We only ask that you keep it HIPAA compliant case for discussion. That means please do not share patient's name, birthday, address, and so on. We learn best from our patients. They are the best teachers. Our interdisciplinary team is here as well, and we are all willing to teach and share our collective wisdom with you. Most of you already know me. I am Lynette Gaylord, President of Alliance of Residential Care Administrators, ARCA. We have Maribel Tan, President of Foster Family Homes Association, Elsa Talavera, President and CEO of All Island Case Management Corporation, May Magnayan, Nurse with Lokahi Case Management, Gabriel Vegalara, Inpatient Coordinator at Aloha Care, Leila Vintar, Health Coordination Manager from United Healthcare, Kauai County, and Dr. Ritabel Fernandez from University of Hawaii. We are in the third month of our series on medications. If you're interested in viewing any of our lectures and handouts, you can find them on our website. Unfortunately, we cannot offer certificates of attendance for videos you have viewed. You must participate in our education live. The title of today's webinar is Practical Applications of Culinary Medicine for Older Adults. It gives me great pleasure to introduce our speaker, Cheryl Yoshimura. Cheryl is a registered dietitian and the diabetes care education specialist with over 25 years of experience in health coaching, medical nutrition therapy, and disease prevention and management. She holds a Master's of Public Health in Social and Behavioral Sciences from the University of Hawaii at Manoa and serves as Kokua-Kalihi Valley's Community Principal Investigator for NIH-funded community-based participatory research projects addressing health disparities, obesity, diabetes, and Alzheimer's disease and related dementias. Co-author of peer-reviewed work on diabetes, obesity, and health disparities among Filipinos, Chuukese, Samoan, and Native Hawaiian communities. Cheryl also pursued culinary arts training at the Culinary Institute of the Pacific at Kapiolani Community College and culinary medicine training at Tulane University. She is passionate about experimental nutrition. She helps patients and caregivers create tasty, beautiful, and practical nutrition moments through cooking. We are so honored to have her speak to us today. Welcome, Cheryl. Mahalo.
Hello, everybody. Happy Aloha Thursday. Am I going now, Mr. John, or are you doing something else? I'm going on. Okay. I am going to share my presentation. Okay, you folks can see my slide? Okay.
We can see it, Cheryl.
Okay,
Yes, thank you.
Before we begin, just to let everybody know, my name is Gabe Vega. I'm an inpatient coordinator with Aloha Care. I'll be assisting with the chat. If any of you have any questions, feel free to go ahead and put it in the chat, and we'll make sure it gets attended to throughout this presentation. Thank you so much.
Thank you, Gabe.
Mhm.
Okay, I'm trying to make sure it's a full screen. Okay, everybody, thank you so much for having me. And so today I hope to be able to provide you some tips and tricks at your fingertips to help your residents. Okay, and so how much am I? Okay. I have 30 minutes to present, and if I rush, blame Juanette. Nah, just kidding. If I rush and the P's and the F's exchange, or they take over, pardon me. That's the Filipino coming out. All right. Here is our objective. So why are we talking about this? Because a lot of you folks, you often receive unclear or unrealistic diet prescriptions, and it's not the doctor's fault. Yeah, without actionable kitchen-ready methods to implement them. Sometimes the special diets that you receive are like super super special that sometimes you might not be able to do them. Okay, so today I hope to provide you with the nutrition principles for meal planning that you can use right after the presentation. Also, apply practical food preparation and cooking techniques that you can apply for dinner. Okay, and prepare texture. So this is going to be our case presentation and case study. It's going to require you to participate, please, please. Otherwise, I'm going to have to sing and dance. So this is going to be the third part where you will prepare a texture modified meal for ease of chewing and safe swallowing. Does nutrition matter? Because there's a high prevalence of malnutrition and chronic disease in your patients. And nutrition impacts hospitalization, healing, quality of life, and dignity. And the diet prescriptions need to be actionable in the kitchen so that you are able to help maintain health and well-being of your residents. So here we go. The core medical nutrition principles, I have here 7, but there's more, but I don't have time to do all those. So for example, a lot of your patients have hypertension. So the core nutrition principle for this is going to limit the sodium and use herbs and spices in their place. And we're going to talk about umami a lot because that's my favorite. Diabetes, this one here requires consistent high quality carbs and high fiber. And a lot of you also have residents who have Alzheimer's or dementia, and this one to help them maintain their nutrition and also their independence. We offer finger foods and also high quality meals and snacks, as well as hydration support because sometimes they forget. And also, very important, the use of adaptive eating utensils and plates. And of course, in their later stage, they will need modified foods. For cardiovascular disease, a lot of times you have residents come back to you after they get hospitalized, and they were before they get hospitalized they were on regular diet, and they come back cardiac, but then everything is normal. So cardiac for cardiovascular disease, low sodium, low saturated fat, and focus on omega-3s as well as high fiber foods. Okay. For weight management, this one here for older adults, I'm not really concerned. I have more problem with providers sometimes wanting your residents to lose weight even though they have been with their BMI since they were in high school, and then all of a sudden now they gotta lose weight. And so the residents, sometimes when I see them, They complain, I'm not trying to lose weight, I don't want to lose weight. But the most important thing is going to be the portion control, offering fiber-rich foods, lean proteins, and not so much of the desserts or the discretionary calories. This one is very important. Frailty. We're gonna need to provide calorie-dense add-ins like milk powder, oil, cheese, avocado, using full-fat options and nut butters if there are no allergies and contraindications. And more and more of you folks are having residents that have chronic kidney disease, mostly non-dialysis, or sometimes they might be on dialysis. And so this one here, limit sodium, very, very important, but they also need to match their protein, potassium, phosphorus fluid needs according to their stage and lab. So just because they go to dialysis does not mean they have to really limit their potassium. It's based on their lab values. Okay, and this one here, we really need to work with a registered dietitian to help you design a meal plan that is for CKD. But we want to focus, if you're going to forget everything that I talk about today, I would like you to focus on using food first approach. Okay, instead of, if the resident, for example, is not eating well, don't go for the, am I able to say brands or no? Okay, don't go for those drinks. Okay, go for food first approach and avoid the ultra processed foods. I'm not saying eliminate all processed foods because they have place on the plate and in our cooking, but the super ultra processed, we want to avoid those things because they give a lot of issues we'll talk about later on. And in here, I just want to say limit processed foods and watch the portions.
Hey, Cheryl, I have a quick question. Specifically for patients that have non-dialysis and dialysis, what kind of challenges do we have, or at least do they have when it comes to what they can and cannot eat?
Perfect. So they are not yet on dialysis. So what happens is they usually go to the provider and they do labs. Sometimes, so it depends on the stage. If they are stage 3, usually the provider will do labs every 6 months. And if they're not, please remind provider to take labs. If they are on stage 4 CKD, so the GFR, so anyone familiar with the CKD stages? Are you folks familiar? We can actually talk about this one later on at the case study as well. But if they are on stage 4, then the labs gotta be done every 3 months. So if you can please remind your providers to check their labs, because usually as they get closer to stage 5, their potassium levels are high and the residents can die of heart attack because high potassium causes heart attack. Yeah. Also, the high phosphorus, that's why I say here, avoid ultra processed because they have a lot of phosphate. Phosphorus is used as a preservative for the ultra processed. And those ones can cause like super itchiness for people who have CKD and like painful kind of itch underneath the skin. Yeah. So usually we need to watch the phosphorus as well. But
Thank you.
otherwise, the protein also, we don't want it too low, but sometimes, if they're eating a lot of proteins, we want to make sure that we balance. And so in terms of, we don't want to use just all animal protein. We want to also use plant-based, like the tofu, those kind of things. Yeah. And then please
Thank you,
make
Cheryl.
sure that you guys have prepare your questions because we want to make sure that we get your answers. Because otherwise you're gonna have to pay for a dietitian. So today is free. Okay, and so think about, so we don't want to focus on nutrients. Sometimes you might have providers who will say, eliminate completely all the grains, for example, or like nothing white or no breads. So we don't want to think in terms of like single nutrients. We want to think in terms of plates. So this one here, if you can imagine, half of the plate is going to be the vegetables. These are non-starchy vegetables. And then 1/4 of the plate is going to be the grains. And then 1/4 is the protein. Okay. But in your case, usually you would have serving sizes in the form of ounces or grams and things like that. But this is just for general information that you want to make sure that the half of the plate or like majority of the food is gonna come from your vegetables. And as you will see, or as you notice, the evaluation that the Department of Health uses has a lot of vegetables because we're promoting fiber. Okay.
And just a sort of side question here. When it comes to portion control, I'm not sure if you would know, but do they typically weigh this type of food before they give it to any sort of patient?
Good question. So for proteins, we want to use weights. You know those food scale usually in the form of grams,
Mhm.
but we use our hands. This is 3 ounce, the thickness of the pinky, that kind of thing, or like the size of a checkbook. That would be like maybe like fish fillet or tilapia or something like that. Most times when you buy your proteins, they do it by pound. So usually when you cook, let's say for example, if you're cooking 4 ounces of salmon, for example, you lose 25 to 30% of that. So it's not gonna be 4 ounces when you give. So, but what I recommend the care home operators that I help is you choose the 3 ounce servings. That
Mm.
way, it's gonna be less than 3. It's closer to 2. That way, they have it. They have protein at lunch and dinner, and then 1 ounce or 2 ounce in the morning time. Or you can have 1 ounce in the morning in the form of eggs, for example, and then for night snack is gonna be 1 ounce. Okay. You don't have to raise your hands, ladies and gents. But when you serve the foods for your residents, which one is it, on the left or on the right? Or do they come in bowls or cups? Okay, so just
Yeah.
put yourselves in your residents' shoes. Which one would make you want to eat? The one on the left or the one on the right?
We have a couple responses, one from Marianne Kakatian saying left.
Mhm.
Very good.
Yes, yeah. So because of all the colors, it makes you want to eat. Yeah, and then so the one on the right, what color? Like I think the piece is like overcooked. That thing is almost olive green already. It's supposed to be bright green. Yeah. And then there's only 2 colors, white and brown. Yeah. So we want to make sure colors. So if you can imagine the rainbow. Okay. And so
We also,
if you want, oh, sorry, go
oh,
ahead,
my
Gabe.
apologies. Oh, I was about to say there is a pretty good question here from Renata asking on
Okay.
hemp seed protein. Has the THC level been measured in these plant-based protein? No one seems to know. It has been Googled, but is this accurate for kids or those who don't want THC? Is there any safe product for hemp seed protein?
Okay, so for the purposes of our talk, I'm not able to talk about THC or CBD, those kind of things, yeah? So that would be an offline conversation, but very important to talk with your providers in terms of those THC. But the hemp seeds that we can buy from the store, they don't have THC. THC comes from marijuana.
Mhm.
Yeah. So CBD comes from the cousin of marijuana. It's not a marijuana plant, but it's from the same family. Yeah. But that's a question for doctor.
Thank you, Cheryl.
Okay. So for the purposes of our talk today, for our residents, usually they're the older adults, right? And then we do have some foster homes here as well, and so or we might have DDs that are less than 60 years old. But in general, we want to make sure that we have all different kind of color foods. Okay, and so you are required from the Department of Health, if you are following the diet guidelines, that you are to provide your residents colorful foods. So we need to make sure that every day you serve greens, orange, red, okay, and all the other colors, the yellows, the orange, and also dairy. Sometimes you have residents who are not able to tolerate milk, but they are able to tolerate cheese, for example. But if they are not able to tolerate, or they want plant-based form of their calcium source, it could be in the form of soy milk, because they add calcium to it. Almond milk is not recommended because if we're using it as a milk alternative, okay, because they don't add calcium. But if you are able to find almond milk that has calcium, the protein in there is very low. So Gabe, I want to go back to your question about CKD. So it would be the almond milk, or like the soy milk or the rice milk, that will be used for residents who have CKD instead of the fresh milk or the cow's milk.
Okay.
And here you also see picture of whole wheat bread and brown rice. And so if your residents will never eat whole wheat bread or white rice, you could actually offer the enrich, which is like, the white, but we want to make sure that we also offer other things. Yeah. The lean proteins are very important, and vegetable protein. Okay, so on your requirement to serve from the Department of Health, you are required to serve. Now it's really good because it's only 1/4 cup of cooked beans. But if your residents will never eat beans, you could, I got permission from Annette, the dietitian at Department of Health, that we could use it as, we could use tofu as an alternative to beans, because, we have residents who will never eat beans. But we're not using it. We would use it in place of the beans, and it not as our protein. Okay. In here, you'll see also spices. These are from herbs and seasonings. I'm going to talk about umami later on. That's my favorite word. Okay. And liquids. So liquids are very important, and it's not just water. It can be in the form of, because a lot of times our residents, even I don't really like to drink water, so it has to be flavored. So I prefer to have soups instead of water, because otherwise I won't be able to, your residents won't be able to meet all the fluid requirements. And we want to use healthy oils in our cooking. Sometimes you might be able to use the not so healthy ones. They would be in the form of the discretionary, like it could be from the desserts and things like that. But in general, when we cook for their meals, we want to use the healthy oils, and we want to reserve the not so healthy fats from the desserts.
We do have a quick question, Cheryl,
Okay.
here from Princess Cindy Lewis, asking what if the client does not want to eat veggies, only wants meats, fish, and fruits, but not vegetables?
Good question. Okay, so what we want to do, you make sure you offer so you got to make sure that you are actually asking for their food preferences. Yeah. But if they refuse to have any vegetables at all, you want to make sure that you document it in your chart, and you offer alternatives. Okay, so alternatives could be in the form of, like blended juices. So the carrots, so usually carrots is pretty much accepted. Carrots, apple, cucumber, those kind of things. Or if you want to buy the one in the bottle, I'm not sure if I can mention brands, but anyway, it comes in a bottle, and it counts as 1 cup of it counts as 1 vegetable and 1 fruit. So
Cheryl,
Cheryl,
you feel free to mention brands. Please go ahead and mention brands.
Oh, okay.
We want this to be very practical for our foster home and care home operators.
Okay, perfect. So I'm talking about V8 juice blends. So the V8 juice blends, it has juice. They use apple juice, carrot juice, pear juice. So the greens, kale. So you can. What about names of stores? Anyway, so those big stores, not the one we have membership, but it's the other one.
Yes, you can mention.
Okay, Walmart.
Please feel free.
Okay, go to Walmart and go to Target. They have those ones. V8 juice blends. So that one, you will be able to meet the requirement for the vegetables if they don't want to have at all. But you still want to document, because the dietitian or the nurse might ask, why are you only giving juice? Yeah. And so you want to document that you have offered different versions of vegetables, but they refused because they never ate vegetables before. And so, but we want to still offer a balanced meal, which will be in the form of the juice, which is okay. Okay. Good question. So keep them coming.
So I do see here a question on what would be considered healthy oils, and I'm seeing here on the PowerPoint plant oils. So which ones would you recommend?
Okay,
sharing?
perfect. So
Avocado,
health,
coconut.
yeah, healthy oils are going to be the avocado, macadamia nut, canola, corn, vegetable. So, but please, please, please do not use coconut oil, okay? Coconut oil is for our hair and for our skin. It doesn't go in the cooking, okay? Because it's very high in saturated fat. So it's going to increase the cholesterol. Okay. A lot of times we might have care home operators that are trying to do their, trying to lose weight or trying to, follow some fat diets. Please do not apply that to the residents because you will get citation from the Department of Health dietitian or the nurse. Okay. Good question. Anything else?
Yes, it looks like we have a question from Cherry Joy. She's a nurse supervisor, responsive caregivers of Hawaii. She's noticed that gout is also common with individuals that they serve. What would you include suggestions for foods that would lower uric acid with our caregivers
Perfect.
in
Okay.
Filipino foods?
Yeah. Yeah. So, very important. Gout. Okay. Gout, it can be managed through food, but it's really, really important. They gotta stay on their maintenance medication because that is the gout actually is a reflection of how their kidneys are working. Okay. And so high purine foods are going to be, I mean, your residents don't have beer, right? Or alcohol. Okay, so that's number one. But a lot of ultra processed foods are gonna have a lot of purine. Okay, sardines. So if you serve it once in a while, it's okay. Because sometimes we have residents who will say, I will not eat beans because I will have gout tonight. We already put it in our mind, we're going to have gout tonight. It is not possible to eat the high purine food like for lunch or dinner and then you're going to have gout tonight. It takes a while because the purine has to get inserted or get planted into the joints of the toe or like wherever their gout is happening. Yeah. So it means that previously they were having the high purine and it gets added. So just eating high purine food one time does not mean you're going to have gout later this week. Okay. All right. So this is just a summary. I think you're gonna have a copy of this slides anyway, but this is just the summary of why it's really important for our older folks. I mean, all of us actually, to have these kinds of foods for overall health. And as you can see here, you will see that I have some canned things in here, some processed, because fresh is not always the best. Okay, you might be like, whoa. Say that again. Okay. Fresh is not always the best. Okay. Seasonal fruits and vegetables are the best. But sometimes, if they're not in season, it comes from other places, it's not on sale. Or it's more expensive even if it's on sale. So I promote a lot of the frozen fruits and vegetables and also the canned. So the canned beans, canned fruits. Okay. The only thing that when I say do not eat canned is the canned meats because those are super high in salt, high in fat, high in all the preservatives, high in purines, high in phosphorus, those kind of things. Okay, and so because the canned and frozen produce, they are usually picked. Sorry, now the Filipinos coming out. They usually get picked during their peak nutritional value. Okay, so if we imagine coming from where now, Australia, for example, okay, it's gonna take a while to get here, so they cannot pick the fruits and vegetables when they are at their prime because by the time it get to our shores, it's gonna be rotten. So they have to pick it when they're not yet ready so that they have time to ripen. So the nutritional value of that food is not going to be the same as the one that's frozen because they pick it when they are at peak nutritional value. They get cleaned and frozen. Yeah, same thing with the canned. Okay, so in terms of the canned, try to select foods that are like in its own juice or light syrup. But if usually the light syrup, they get picked first, they get bought first, or sometimes they're not on sale. So not a problem. What you do, you open the can, you drain the liquid, you put water, shake, 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 and drain. Because the extra sugars are in the liquid, yeah, in the syrup. So you just drain it. Okay.
We do have a question. Someone believed that canned fruits typically had plenty of sugar. Is that true, Cheryl?
Yes. So there's three different kinds of canned fruits. One that we always see when we go to the Filipino store and the fruits are from the Philippines or like other countries. Okay. So they have the heavy syrup. That one is loaded with sugar. Okay. So the syrup, so if you try to touch the liquid of the light syrup in its the can that it says in its own juice and heavy syrup, the one that's in heavy syrup is very sticky because it's loaded with sugar, okay? But it does not mean you cannot use it. As I mentioned, you just drain the liquid, put water, shake, 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 and drain, okay? Then it will become like the light syrup. Yeah, okay? But if you prefer to use fresh fruits, go ahead, feel free, but make sure that they are the seasonal one because the seasonal one usually, it's cheaper and also they have more nutrition because it's available. So instead of like it's coming from a very very far away place that it's gonna take a while to get to our shores. Okay, right. So very very important. Oops, sorry.
So it also looks like, Cheryl, sorry to interrupt. We
Yeah.
have one from Emma. She has a patient that only eats beef, pork, and chicken, no fish, shrimp, and turkey. Even fruits, he can only eat an apple, peach, and pineapple. She's asking if she can repeat his menu, and what your recommendations would be, Cheryl.
Perfect. Okay. So again, very important. We want to honor our residents' rights. Yeah, and also honor dignity. And so but we want to make sure that we are offering. Yeah. So so later on when I talk about cooking, we're going to talk about like the different ways to cook because sometimes when we just make the food like the same way we always do, it can get boring, especially, they've been with you for like decades and we offer the same food. It doesn't even it's not even cooked yet. We're just talking about it and we're like we nauseated already. I have the same problem. Okay, so we want to make sure that we cross utilize and repurpose our food so that it looks like wow, it's new even though it's not. Yeah. Okay. So I want you folks to please remember there is no one single dietary pattern that's suited for everybody. It's no one size fits all. So like the question like okay, he only eats certain foods, but you have to offer all the different varieties. So if he eats only chicken, beef, pork, okay, shrimp and things like that, the other residents cannot just have those things. So you still want to offer, but then maybe the way that you will cook. So it's really important to be talking to our residents or the family if they cannot talk anymore or like they don't remember, to talk with the family. What did they like to eat before? Because then it brings back memory, it brings back the appetite, things like that. Yeah. Health promoting eating patterns never need to eliminate for the entire food group. Some of you folks might be trying to lose weight and you completely blame the rice or blame the bread and all of these things. And so you cannot completely eliminate those things because it provides other nutrients as well. Okay, so eating a wide variety of foods across all the food groups like you are seeing on my screen right now promotes greater nutrient intake and better health outcomes. Okay, and as I mentioned already, fresh fruits and vegetables are not always the best. It just depends on the season and if they are on sale.
We
Okay.
also have a question for alternative with rice. does not eat much rice. So if there's any alternatives with myself,
Oh, you
Spanish
went.
background, and I eat a lot of rice. So this
Mhm.
would definitely help myself too.
Yes. Yeah. So you don't have to eat rice because in the food group, in the grains group, you have all kinds. You have couscous. You have all kind of grains. You don't actually if you're not a rice person, there's also noodles, pastas. Those counts as grains. Yeah, so it doesn't have to be just rice. I mean, if they like, they're used to eating black rice or red rice. Those are also available, but it does not mean you have to just eat rice. Okay. So these are very important key nutrients for our seniors. Okay, protein, the B vitamins, the fiber, vitamin D, calcium, and calories. So if you eliminate one food group, you are going to be missing some of these nutrients. Okay, and so for most of you or all of you should be familiar with this menu evaluation that the dietitian uses to evaluate your menu. And as I mentioned earlier, the vegetables, look at that. 2.5 to 3 cups of vegetables for the whole day. That's the requirement. So for the resident that you have that never eat vegetable, that's going to be very hard. Yeah. But the most important thing is you document that you're offering alternatives, you're getting their food preferences, things like that.
And you mentioned, I know vegetables is definitely not a preference for some of these patients. And you were saying the V8 juice helps a lot,
Yes.
especially okay.
Yeah. So the V8, 1 cup of that juice blends, yeah. Or you can also the thing with just the vegetables, it's not a sweet, especially if our residents they like to eat they like to drink juice. So the combination of the juices gives you that nice flavor. Yeah. So it's the V8 juice blends. Okay. Okay, as I mentioned earlier, if you want, we don't want to eliminate the whole food groups, but if we want to focus on a single nutrient, we cannot eliminate because naturally it's occurring in food, but we want to limit the sodium. Okay, so this is my first question. Ay shucks, I don't think I put Oh, oops, too fast. Hold on, sorry.
Take your time,
Okay.
Cheryl, no rush.
Okay, so sodium in the American diet. Okay, the recommendation is 2,300 milligram for the whole day. Okay, if someone has uncontrolled blood pressure, it's even lower, 1,500 milligram. Okay, in the whole United States, the average intake is 4,000 to 6,000. And most of it comes from restaurant or buying out as well as processed foods. Okay. Okay, here's my question. In Hawaii, what do you think is the average intake of sodium?
A whole lot from
Yeah.
from living here. Yeah, I definitely
Yeah, it's more
almost
than the
double.
six. Yeah. It's 8,000 milligram. Yeah.
Wow.
Because what happened? Because we got all the spam, the corned beef, the Portuguese sausage, yeah, processed kind foods. And also because we are surrounded by the ocean, naturally, we like to eat salty foods. Yeah. Yeah. But also in a lot of times when we cook, we already using fish sauce or shoyu and we're still adding salt. And then later on we're going to talk about umami because we don't need to use salt. Because salt is just salt, but then the umami, the shoyu and the oyster sauce, even though you only use a little bit, it gives you that nice full flavor. Okay, this one here, I'm going to make it into like a handout that I think John is gonna post it on the website and then you guys can print this and put it on your refrigerator because you might have, even though the 1,500 milligram sodium is really very difficult to do, but these are the ingredients or like the seasonings that you can use to help decrease the sodium in the contents of the foods that you're offering to the residents. Yeah, so these are like herbs and things like that. Hey, here's my favorite, umami. Are you folks familiar with umami? Yeah. Okay. So
Yes.
umami,
Very much
what
so.
is umami? What is umami?
Different sort of ingredient for different seasonings, food, veggies, very salty.
So umami actually is Ajinomoto. But umami comes naturally from food. Yeah, so the Japanese, they were so smart, they created Ajinomoto, but actually umami is the fifth taste. It brings you that nice deliciousness that you cannot explain. It's a combination of all the different flavors, okay? If we use too much of it, it's going to be too salty and it even gives you that bitter taste, okay? So that's why I like umami, because even if you only use very little, it gives you that nice flavor without having it too high in salt. Okay, so what you see over here, I don't know if you can see this one here is the kelp. So the kelp is seaweed. You can get it from Dai or like any kind store. It's dried seaweed. So what you want to do is you want to boil the kelp, and you boil it for like maybe 1 hour and then simmer, and then you just keep adding water, and that gives you that nice, very, very nice flavor without adding salt. And then you can use that as a base to make your soups. Yeah, that way your residents will enjoy without having to worry about, oh, there's too much salt. Yeah, and then the fish sauce, shoyu, oyster sauce, miso, those those kind of things are also very useful, because you only need to use it a bit. Here's the thing: if you are using these things, no need, please, no need add salt, because it doesn't help. Yeah, so just use little bit, using a lot of the and also the way you cook, braising or roasting, okay, is going to help break down the natural umami, glutamate, in the food that gives you that nice flavor. Okay, using cheese, not a lot of cheese, but using cheese in the food is also going to give you that umami. Okay, using your vegetable to make broth, for example. Also, like, when you have your crabs or your shrimp or seafood, the shells, you can actually boil, and then after that simmer. Okay? It gives you that nice, very, very rounded flavor to make your broths. Okay.
Is umami at all equivalent to MSG, Cheryl, or
Umami is called the fifth taste, delicious, savory. Okay, but umami, so Ajinomoto gives you an umami taste, because the Japanese, they were able to create a chemical. Okay, but you can get it naturally in the food, like what I'm mentioning over here. Yeah. So if you use Ajinomoto in your cooking, it's not a bad thing. It's just very, very little, because it gives you that. And then very little amount of Ajinomoto to like maybe like 2 gallons of water is gonna give you a lot of flavor. But you don't have to do that, because you can use these things. You can use the kelp. You can use the seaweed to boil. You can use the bones. When you buy that rotisserie chicken, you can buy those things, and then you boil it. It gives you that nice umami flavor too. Wait, 240. Okay. Okay. Now we're gonna go into the cooking preparation and cooking techniques. Okay. So this one very important. The type of the way we cook is going to give you that the taste, it also the texture that our residents will be able to enjoy. We don't want too much like raw, because it's very hard to chew, or like, you know, they have ill-fitting dentures, or they don't have all their teeth, or even if they do, eating raw sometimes, as we get older, we get too much gas, those kind of things. So blanching, boiling, braising, poaching, pot roasting, simmering, stewing, steaming are very, very good ways of preparing the foods for the residents. Okay. Also, you wanna use sauces and gravies. These sauces and gravies are from the foods that you cook, not the kind you buy from the one that comes in a packet or the jar. Okay. But if you do decide that you wanna use the jar, the Heinz is a good one because it's considered low sodium. Yeah, to put it as a gravy for the proteins, or for the potatoes, things like that. And then I mentioned about using herbs and spices for adding flavors.
We do have a
Question?
couple questions that came up here, Cheryl. A
Okay.
question. So what about magic syrup?
Magic syrup is terrible. Please, please, please do not use that. Loaded with sodium. Okay. I want you, if you are near your kitchen right now, go get the magic syrup and look at the label. It's in the thousands for the sodium content. Yeah. At least depending on the serving size. So you gotta look at the serving size, but it's at least 600 or more per serving. That's no. Magic syrup, no. Yeah. So please throw it away. Okay. I talked about umami already. So batch cooking and freezing. For example, if you have residents that have that require texture modified foods, it's okay to prepare ahead of time and freeze them in the serving sizes that they would need per meal, instead of putting it in big Ziploc bag and then you gotta defrost, because you only can defrost one time. Okay. Cross utilization and repurposing of ingredients and leftovers make up for like new items, and it stimulates creativity. So the residents will be, even though you serve it the other day, if you serve it again, but it's in a different form, they'll be like, whoa, this one is good. Yeah, it tastes good and things like that. So it encourages creativity, but also it helps you save money. So you don't have too much left over and throw away. Okay, these are some examples of what you can do when you prepare food. So right here we have stir fry. Okay. So stir fry, the foods, the vegetables are still crunchy. They're still pretty much closer to raw. So what you would do is you're gonna need to cook the vegetables a little bit longer, but don't cook for too long, because then they turn into like olive green or like look like vomit. So then that would be not good. But you can use all kinds of different kind of proteins that you want. And so what you can do is you can create a base so you would brown your meat first and put it aside. Now you're gonna do your vegetables. Okay, you cook the vegetables, and then depending on, for example, the resident is allergic to seafood, for example, but you're having seafood at that time, you're gonna need a tofu or chicken or some kind of protein to that vegetable that you put on the side. So you're making one base, but it's for like different clients. Yeah. So stir fry for residents that are on regular diet, okay, but for the ones that need a little bit softer, even though they're not on special diet, you want to cook it a little bit longer. So you can see over here, I have a frozen vegetable. I like the frozen vegetable because it meets your requirement to serve different color vegetables. Yeah, and then you don't have to chop. It's already chopped, ready to go. Okay, this one here is...
Oh, sorry, Cheryl. I know you're trying to beat the clock right now. We do have a couple questions. So, what about Himalayan pink salt, bouillon cubes, and mushroom grains?
Okay, good. Okay, so that was gonna be our activity, but this is good. Okay, so a lot of times folks will say, oh, I don't use the blue salt, the iodized salt, the Morton salt, but I use Himalayan salt, or I use Hawaiian salt, I use the rock salt. No difference. Salt is salt. The body cannot say like, oh, I'm not gonna increase your blood pressure, or I'm not gonna cause you to have edema because you had Hawaiian salt. Okay, salt is salt. Same thing like sugar and honey and brown sugar, they're all the same. Salt, sugar, in terms of how much glucose it's gonna give you is all about serving size. Yeah. Bouillon is the same thing like the Maggi Savor or Magic Sarap, they're all the same. So if you want to use those, I notice when I visit some homes, they have a lot of those cubes and they use multiple. Okay. You only need to use one for a big pot. And so very important too, you don't want to the liquid is the one that has the flavor. Yeah. So the meat might not have a lot of the salt, but then it's in the liquid. So please, you gotta measure. You have to measure the amount of salt that you're using or the amount of seasonings that has salt that you're using. Okay. So this is also another example of how you can make sure that you create a base and then it can be offered to everybody, even though they are they have different diet orders. Okay, so this is making your own stew. So if a resident doesn't want to have seafood, but then you are required to serve fish, 8 to 8 ounces of fish or seafood for the whole week, and the resident only wants to eat beef and pork and chicken. Okay, you could have one serving of your ingredient and then just add the meat. So what you can do, as I said, you make ahead, and then so the meats that you have, it's already in the freezer by portions. Okay, so that way you can just add it to individualize their meals. 10 minutes. Okay, and then this one here, soups. A lot of times our residents don't want to have water because they don't want to keep using the bathroom or like the water, the motes. So having soups at lunch or at dinner, or it can also be during snacks, will help them meet their fluid requirements. Okay, here we go. Texture modifications. There's 2 different types that we're doing texture modification for. One is for ease of chewing, for missing teeth or ill-fitting dentures, or they're tired, they don't want to chew. And so the goal is to offer softer and easier foods to chew. And then again, you want to make sure that when you cook, you stew or braising or slow cooking, it's gonna break down the muscles of your the proteins, so that way it's soft and then it's very tender. Okay, same thing with the vegetables. So when it comes to soft cooked vegetables, the carrots, the zucchini, green beans, sometimes when we make stew, we use celery, and the celery sometimes is very stringy. Yeah, so you could just put it aside for the residents that require softer foods. Then you put the celery on the side, and then just offer the potato, the carrots, those kind of things, the zucchini. The other type of texture modification that we do is for safe swallowing. This is for residents who have dysphagia, or when there's aspiration risk, they had a stroke, or they have dementia later stage, or Parkinson's, or they had cancer treatment, radiation, or chemo that affected this part of our body, so we cannot chew too well, or we cannot swallow too well. So to prevent aspiration, we want to make sure that we offer this one here. I'm sure you're all familiar with the IDSI. Yeah, so this one here is the dysphagia diet. Okay, so it's different from the ones that require for chewing, because in for dysphagia, cannot have rice, cannot have stringy foods, they cannot have raw, they cannot have sandwich. But for the softer foods, because of chewing, they can have sandwich. What you need to do is you just remove the crust, you cut it in smaller bite-sized pieces, and remove the rib of the lettuce, for example, if you're using lettuce. Yeah, or it's better you use the spring mix, the younger leaves, versus using romaine, for example. Okay, now we're almost to our activity, but this is to help you with modifying textures. You don't have to make separate foods or extra foods unless you're doing sandwich and you have a dysphagia resident. But whatever you're serving as a regular diet, you can modify it to go into soft bite sizes. You just need to cook a little bit longer and then chop it down, okay, to about 1/4 inch. Okay, and then if it's mince moist, those are like the ground, then it's 1/8 inch. So how do you know it's 1/8 inch? When you press down the fork, so the fork, there's spaces in between. The space in the fork, that's 1/8. So that's how you can tell. If the thing is bigger, then you gotta chop it a little bit more. I like to use, you know, those food processor. My favorite is either Cuisinart or Ninja. The one that comes in like 4 cup and then you pulse. Bzz, bzz, bzz. Okay. And then after that, you just want to make sure that you test it to make sure that it's actually meeting the size. Okay, this is it. Okay. So this is just a review, the takeaways of what I just mentioned. You will have a copy of this anyway, but now we got to go into our case presentation. So now very active. I want everyone to be awake for this one. Okay, case study. Mrs. Tanaka is 87 years old. She has dementia, hypertension, poor dentition, and recent choking. You received this resident. I don't know. Let's make it like new resident, or it could be that they came back because they were hospitalized. Okay, so they come back, and the diet order now is chopped, 1800 kilocalorie, low sodium, no concentrated sweets. Okay, and the meal. The menu that we have is fried pork chop, because originally everybody is on a regular diet, yeah? So you have fried pork chop, carrot sticks, and apple juice. How are you going to make this safe, realistic, and enjoyable for Mrs. Tanaka? Okay, unmute everybody. Oops, sorry. Shucks. Okay, what are we going to do? What you gonna do when you receive this resident and then they have a discharge order? Don't wait until inspection month now. You gotta check the discharge order right away.
I would check to see if there was a swallow eval done first, because she shouldn't be on chopped if she had a recent choking. She should be on pureed.
Okay.
Or I would actually ask too for consult with the RD to do a new diet menu.
Okay. So what about those who don't have a dietitian? What you gonna do? I think it's faster if you folks say it versus typing in the chat, because we only got, shucks, 4 minutes.
Ask the doctor to
What
explain.
you do? Ask the doctor to explain, to clarify. Okay, all right. Okay, good. So you called the doctor, you called the provider, okay, to clarify the diet. And then so after chasing the provider down for 3 days, you finally get a diet. And the diet order is soft bite size, 2 grams sodium. Okay, soft bite size, 2 grams sodium. How are you going to make? So let's say we have a resident. This one here is only for ease of chewing. Ease of chewing, no dysphagia. How would you change this menu? Fried pork chop, carrot sticks, rice, and applesauce. What would you do? Without consulting the dietitian.
I wouldn't
Yeah.
fry the pork chop. Oh,
You have to make it so you have to make sure they're soft.
yeah.
Okay.
Yeah.
Okay,
And
so I
no
talked
carrot
about,
sticks.
yeah, so I talked about different ways, the cooking methods. What kind of cooking method would you use?
I'd grill it,
Steam it.
Bake.
air fry.
No,
Okay, so
not
I talked
steak.
about moist
Mixer
cooking
fry?
methods.
Stew.
Stew, yes. We want to use moist
Grease.
cooking method. So I mentioned about 7 different ways. So stew, we don't want to grill because that's a dry cooking method. We want moist means we adding liquids into the cooking, braising, stewing, those kind of things. Yeah. Slow cooking. Okay. So how would we serve it? So we still have the pork because that's what we have. Everybody else is eating the pork chop except for this resident. Yeah. So you're still using the meat, the pork, but now somebody said stew. Yeah, so that's good. And then you already have the carrots and potato, and what else you have in your stew?
Tomato.
Tomato, okay. Celery, you might have onions, but so you don't have to use all the vegetables in there. That's gonna be hard for you, yeah. So you could use the carrots, the potato. If you have some green beans in there, that's okay too. Okay, and instead of rice,
Arroz caldo.
arroz caldo, yes, yeah. But for this one here, because they don't have dysphagia, it's okay. They can have the rice. We just want to make sure it's a little bit softer. Yeah. Okay. And for the fruit, the apple juice that originally you have on the menu is fine. Okay. But you could also have, more whole food. Okay. So the canned fruits or the papaya or the banana, those kind of things. Okay. Ay, sorry. Last one. Okay. Let's say the patient has dysphagia. Now you're gonna go to the safest one is gonna have to be pureed. Yeah, but this one here, you're gonna need a doctor's order. For any modification, you will need a doctor's order. And please remember, you must puree the foods separately. Please do not put the food in a cup because we're supposed to eat it with a spoon, not drink. Yeah, and then do not use raw vegetables or salads in your puree because how it's gonna look like what? Look like vomit or baby's doo-doo. Nobody wants to eat that. Yeah, even though, in the original form is very pretty and stuff, but once you puree, it's so gross. Yeah. Okay. Audrey, yay, thank you so much. And very, very important, nutrition must be actionable in the kitchen. We can have all the diets. A lot of times, some of you ask me to help you with your diet prescription and you want all the diets under the sun. Okay, but so I try to discourage you. Do not have all those diets because you're not going to be able to make it. If you have 5 different diets, so the one that's most common, and you have to speak up for also for your residents because if they're 93 years old and you give them cardiac diet, sister, let them enjoy life. Let them enjoy food. Yes. Okay, so thank you so much, everybody. Sorry we went over.
Thank you so much, Cheryl,
Thank you
for
so
the
much, Cheryl.
wonderful presentation. So I just want to remind everyone to please complete your evaluation. For those of you who have more than one residence, please, it's similar to what we've done before. So start with the the first resident that you admitted into your home. And you'd mark at the top, is it, less than 1 year, 1 to 3 years, to start there and answer those questions, 5 questions. And then you, again, answer the same questions for your resident number 2 and then your resident number 3 and so on. If you have any questions, feel free to shoot us an email. John already put the evaluation link in the chat. So hopefully you saw that. Again, we need to have your correct emails for your certificate of attendance to be issued to you. Make sure that we have your correct names as well, and email, of course. Let's see, what else am I forgetting? I think that's it. And thank you for all that you do in caring for all our residents. I know you guys are all hardworking out there, and we appreciate you. And again, thank you, Cheryl, for the wonderful presentation that you just provided us. Have a wonderful afternoon, everyone.
Mahalo
Thank you.
nui loa,
Mahalo.
Cheryl. See you later.
Thank you. Bye-bye.
Thank you.